Queensland Health says a man who recently returned to Australia from Wuhan in China is being tested for a deadly new strain of coronavirus. Queensland Chief Health Officer Jeannette spoke on the issue a short time ago.
Is there any particular preparations that are being taken in Queensland, particularly in far north Queensland, to get ready for this if it does reach out?
Right. So I've sent out advice last week to all GPs, all emergency departments, private hospitals, various clinical groups to be aware. So at this stage, anyone who returns from Wuhan, which is a city of 11 million people in the centre of China, where we're seeing this virus currently circulating, and if they develop any respiratory symptoms, cough, fever, sore throat, then we're asking GPs and emergency departments to collect certain specimens and to send them down to Brisbane where they can be tested for the new virus. Plus, we're then asking people to remain reasonably isolated.
Can you confirm the number of deaths? Have you heard any information of that?
So at the moment, the World Health Organisation is stating that there have been 3 deaths.
Okay, and how does the virus work? How is it transmitted? Do we know that yet?
It's a coronavirus, so it's transmitted the same way through as with all the other coronaviruses, which is through the air. Now, initially, it's thought that it probably came from animals at their live market in Wuhan, from the animals to the people. Last night, the World Health Organisation confirmed that there has been human-to-human spread.
How concerned are you? Looking after Queensland, are you concerned for our state?
This is a new virus. We see that every so often, and we manage that. There's no vaccine at this stage for this virus, and we don't see one on the horizon. There's no specific treatment other than supportive care. From China, we understand that they've seen around 200 cases admitted to hospital, and out of those, about 9 or so have been serious. So it's a variable virus in terms of its impact. As we know with a lot of viruses, there are some people that will get a cold-like disease, and other people will have more serious disease. And those people, of course, are those who are the more vulnerable, people with chronic disease and the elderly.
So there's been cases in Japan and Thailand as well, so if
Yes.
people are travelling there, should they be careful? Or?
Well, no, because the majority of the cases at this point in time are still in Wuhan. So they've seen 198, then they've seen a few cases in Thailand, Japan, and I believe South Korea's notified a case. So that's just related to the amount of movement between China and those countries. So we need to be alert to this, as we are. All our GPs and emergency departments are aware and have prepared. Our pathology service has ordered in the primers, so they're able now to diagnose specifically this virus if someone were to develop the illness. We've got one gentleman that we're just following at the moment who has travelled to Wuhan and has developed a respiratory illness, but he's recovering at home, and so we've done some tests on him and we're awaiting results.
Is he a Queenslander, sorry?
He's here in Queensland at the moment.
Okay, so does he live from Wuhan, or does he live in Queensland, or?
He's here at the moment, but he's got family back in Wuhan.
Okay.
Is he in Brisbane?
He is in Brisbane, yes.
And how do we know that it is this
No,
virus?
no, because we don't have the primer yet.
Yeah.
So the World Health Organisation released after China gave them the specifics, so that's now available. So now we need to obtain the primers that have been developed against this specific coronavirus.
How long does
right.
it take?
A few more days, we expect that any time.
Right now, is there current airport screening being done at our international airports in Queensland?
No. Last night, all of the chief health officers from around the country and the chief medical officer from the Commonwealth met to discuss what measures should be taken going forward. And at this stage, they're looking at meeting the planes that come directly from Wuhan into Australia. So there are 3 flights a week that fly into Sydney Airport. And they're looking at processes to meet those planes. But essentially there are a lot of Chinese who do travel between Australia and China, particularly as we're moving into the Chinese New Year festival period. So the advice is that anyone who travels to Wuhan and then comes back and is unwell to go and see their GP or an emergency department and to isolate themselves from other people.
And what are those symptoms? Is it like flu?
Yeah, flu-like symptoms, so cough, sore throat, fever, those sorts of symptoms. So the more critical cases, the people have developed pneumonia.
And can you just explain why this particular disease is so much worse than a different type of flu?
It's not a flu, it's a coronavirus, and it's not necessarily worse, it's just new. It's a novel coronavirus that we've not seen in the world before today, and initially it was transmitted from animals to humans. We suspect, we don't know, that's not being fully worked through. That first came out 31st of December when China notified WHO. So we suspect that the transmission was from animals to humans. They closed the market that they think the source was on the 1st of January, but we've now seen ongoing cases, and last night the World Health Organisation came out and said that there's clearly been human-to-human transmission, but not a lot. So there's been some transmission to healthcare workers, but not a lot. And similarly, China's been closely following up contacts of confirmed patients and not seeing a lot of cases. So there's some human-to-human transmission, but at this stage it's not, there's not a lot.
That man that was picked up with a respiratory condition from Wuhan, was he picked up at the airport or did he go to a GP himself?
He went and saw a healthcare provider. Yeah.
When you talk about the primer, is that like some sort of DNA or something that allows us to identify that it's this particular virus?
Yes. So at the moment we can only do a generic test for coronavirus. We can't do the specific test for this specific virus because we haven't seen it before. So then we've got to develop the specific tests to be able to say it's this particular virus.
So you expect to be able to do that in a few days?
We hope to, yes.
This is a stupid question, but I'm going to ask. So, do we often diagnose coronaviruses here? Because SARS was a coronavirus, wasn't it?
We haven't seen many here that we diagnose. I mean, coronaviruses can cause illnesses ranging from a cold right through to SARS, and the other coronavirus that has caused concern in the last few years is MERS from the Middle East. So they're the two that we've had most concerns with, but there are a lot of coronaviruses out there, a large number. The reason this one has now been picked up and diagnosed is because it is causing severe illness in a small number of people.
And is that mostly in children?
No, most of the cases to date have been 20-year-olds through to 80-year-olds. There's been none in children, but that's probably related to who's visited the market rather than anything else. So, and this is very, very early. This disease was only first announced, and they didn't know the cause of it, at the end of December last year. We're only mid-January, so in a few weeks we've gone from not being aware of it to having a small amount of information, and that will increasingly become available over the next few days.